I'm very keen to get on to the NHS, but first, if I may, I just want to get your reaction to the Westminster Accounts project, launched by Sky today, a transparency tool, effectively, for the money that is coming into politics. Do you welcome more transparency?
Well, I was an MP when the expenses scandal broke a number of years ago, and of course we all welcome the transparency. It is very clear we all have to declare any outside interests, any outside earnings, so people can go onto the Parliament website and look for themselves as well. But I think, what was important during the expenses scandal was to try and end professional politicians just being the only route into being an MP. And so you are seeing people coming into Westminster with outside interests. I'm a nurse, I still work as a nurse, I declare those earnings on my website, and then, cross-party, we have doctors who work in the Labour Party, on our side in the Conservative Party. And I think it's important that people are able to keep their interests in that sort of field going. It certainly helps me in terms of my work as a local constituency MP, but also as a health minister to really see what's happening on the ground.
Well, let's bring up your own entry, shall we? Because you mentioned it yourself. We can see your entry on the database here, and we can look in a bit more detail at some of your own donations and earnings. The first thing, if we have a look, that stands out, as you mentioned, the £8,890 of earnings from the Royal Marsden Hospital. So that's your work as a nurse that you continue to do.
Yeah.
And I guess some would argue that's a good example of MPs having outside earnings.
Well, also, MPs like myself, politics is a fickle game. If you're not elected at the next election, then I would go back to working as a nurse, and you have to keep your registration. So sometimes there's a practical element to it. And actually, my constituents really were pleased to see me go back during COVID, back onto the wards and help out where I could.
And I guess it gives you a perspective on some of the issues as well.
Absolutely.
You can also see there at the bottom, £3,250 of gifts from the Betting and Gaming Council. What was that in relation?
So that was an event I went to. I went to Wimbledon, and a constituent invited me who happens to work for the Betting and Gaming Council. So, and that's what I mean. Transparency is there. My constituents can look on the website, the parliamentary website, and ask me, well, what is that about? You can see donations there that were for the last general election. Now, they come to the party, but if they're allocated to you, you have to declare them.
And you've got a swing seat as well, I guess.
And you will be getting donations coming up to election time.
I just want to have a look at the bottom one a bit more, because we can also have a look at the total recipients for the Betting and Gaming Council, another feature on the website. You're one of around 30 MPs who receive gifts from them. Now, on their website, they say they represent betting shops, casinos, online and bingo. They work to, in their words, drive high ethical standards, create a culture of safer betting and gaming, and build public and institutional trust in our world-class industry. Now, as you say, all these gifts have been declared in the proper way, they're within the rules. But in your view, is it appropriate?
Well, my example is one from a constituent who works for them, so you have to declare that there's a vested interest there, and that is to make it open and transparent. I haven't actually been involved in any work with the Betting and Gaming Council, but that's the level of transparency that I have. Is there any connection at all? And as a minister, you also have to declare any interests too. And
then overall, on earnings, we found that MPs have earned £17.1 million today on top of their salary since the last election. And I have to say, that is overwhelmingly Conservative MPs. £15.4 million of that money from Conservative MPs. I mean, is that OK, in your opinion?
Well, I think when I was watching the report earlier, two of those are from former Prime Ministers, and former Prime Ministers do get paid for political speeches, so it's part of their political work. But I think the best judges of all of this will be constituents. And, if constituents don't feel that an MP is giving 100% to their constituency, they've got the ballot box to make that ultimate decision. And I think, someone like Theresa May is, fantastically well known for working so hard in her constituency. Even when she was Prime Minister, she was marshalling fund runs and sporting events. And I think the current Prime Minister is very, very clear. He expects every MP to give 100% to their constituency. And it is possible to work full-time as an MP and to do other things. I do night shifts and weekends so that I don't impact on my constituency work. But I think it is important that MPs do have come from the real world, and that sometimes will mean that they do have jobs outside of Parliament.
I guess there's kind of two sort of concerns people may have. The first one about whether or not MPs are really focused on their number one job, which is being an MP. And I think you kind of touched on it there. I guess the second one is that these companies are indirectly buying influence in Parliament.
Well, what I would say, I mean, sometimes I do take the view that sometimes it's always portrayed that MPs are on the make. You know how long hours MPs work. It's a 7-day a week job. We work long into the night many times a week, not just in Parliament, but in our own constituencies. This week I've worked, 7 days a week. I'll be working 7 days a week this week as well. So it is a very, very long, unsocial job. And I just sometimes think it's important that we also reflect the good work that MPs do, as well as some of the concerns. Absolutely, that's why the transparency rules were brought in, so that any donation, any income is there for everyone to see. And then constituents can make their own minds up about whether their constituency MP is working hard for them.
OK. Well, let's have a look now, shall we, at the NHS with your kind of Health Minister hat at. We touched on it a bit with your work at the Royal Marsden. It feels to me like a lot of people might be genuinely quite frightened right now about the state of the health service. I mean, we can just take a look at this graph. This shows the number of ambulances waiting longer than an hour to hand over to patients. So we know what that means. That's ambulances backed up outside hospitals with people inside that can't get a bed. It's concerning. The red line at the top is this current year. And you can see it's far higher than at any point during the pandemic. I mean, is this a health service that's in crisis?
Well, winter is always a difficult time. My 25 years of nursing,
But we can see the comparison to other winters here. It feels an exceptional winter.
It is an exceptional winter. And I was just about to say that, I've worked in normal winters when we've had ambulances queuing and declared critical incidents at the A&E that I worked at. But this is a different year. We're seeing a twindemic of both COVID and flu. So we're seeing, even compared to in the last decade, the most flu admissions that we've seen. There's nearly over 5,000 people in hospital at the moment with flu, over 6,000 in hospital with COVID, and many of those are over 65 with lots of comorbidities, which means they're much more unwell in hospital. And that shows you the scale of the numbers that we wouldn't normally see even in a winter when we have normal winter pressures. And staff are also facing those pressures. We have around 60,000 staff members in the NHS off sick in any one day at the moment because they too get respiratory illnesses, COVID, flu. And so that's also having an impact on services. So this is a very, very difficult winter, even compared to most usual ones.
I mean, our next guest, who we'll hear from in a moment, Dr. Adrian Boyle, President of the Royal College of Emergency Medicine, he believes there are around 300 to 500 unnecessary deaths every week because of delays in emergency care. Do you accept people are dying because of delays? Well,
we know that this is a difficult winter. We know there are excess deaths for a number of reasons. The Chief Medical Officer has outlined
delays in
some of those. I don't recognise the figure that you've quoted there, but what I can say is that we are working really, really hard to get people into hospital. We know that around 13,000 people are in hospital in any one day that shouldn't be. That is a shifting group of people. That's not the same 13,000 every single day. If you look at December, we got 8,000 of those patients out of hospital with care packages either to home or to care homes or to other settings. And yet the next day, another group of patients are admitted really unwell with COVID, with flu, with respiratory illnesses. And they are often complex patients who, again, will take time to discharge. That's why the Prime Minister held the forum yesterday with a range of health professionals to see what more we can do. We've given 500 million this winter to get social care packages in place, to get people out of hospital, because that's the number one reason why ambulances are stuck at the doors of A&Es, because they can't unload their patients, because A&Es can't discharge their patients to the wards. So that's why we're focusing on social care.
When I interview people who work in the health service, I think there's a bit of a frustration, frankly, at the government trying to say that this is just because of COVID, it's just because of an exceptional flu year. And they say it's actually because of underinvestment in the health service that goes back for years. And I just want to have a look at this. This is a funding chart, and it shows the annual changes in health spending. And you can really see that from when the Conservatives came into power in 2010, there has been a queer squeeze in funding for the health service. I mean, you're a nurse, you obviously care deeply about the NHS. Do you understand why people might be, angry, I guess?
Well, you've missed off a couple of years there. So
to be fair, it's not been missed off. This is where it ends, right?
Well, no. So we've increased by 11% the funding in the last couple of years.
Do you accept that since 2010, between 2010 and 2020, there was a squeeze in funding for the health service that people are now saying in the health services is directly related to a shortage of beds, a shortage of doctors,
well,
and
what
the delays we're seeing now.
What I would say is that, and the Institute of Fiscal Studies have highlighted that, and they're not exactly friends of the government, that there's record levels of investment. There is an 11% increase in funding, which is missing off your chart. That has meant that we're opening up 7,000 new beds in the NHS. It does mean we're recruiting over 10,000 more nurses, which are in place now.
So are you having to make up now for underinvestment under previous
Conservatives? We are investing in record levels of funding, not just for the NHS, but also for social care. And these issues that you see around ambulances queuing up, beds not being available, they're in all 4 devolved nations. Whether it's Labour, who are running the NHS in Wales, are facing exactly the same pressures, and sometimes their performance in certain indicators are worse than in England. The UK government just runs the health service in England. The SNP in Scotland are facing exactly the same pressures. And it's not just within the UK. If you look at other countries, Ireland, Italy, Spain,
Germany,
let's
look at some other countries, shall we? Let's look at some other countries, because I think we can also show, here we go, this is hospital beds per 100,000 people. The red line in the middle is the average, and then you have to go all the way down. Only Sweden is lower than the UK. So if you're looking at international comparison on hospital beds, we're doing pretty poorly. So
yeah, again, you're looking at 2020 data. In the last 2 years,
latest available,
we're opening up 7,000 new beds within the NHS. We have opened already over 90 surgical hubs, which is tackling our surgical backlog of 7 million people. We've cleared almost completely.
For 13 years.
But we've cleared almost completely the people waiting for 2 years or more for their surgical waiting list. We're on track to meet those waiting 18 months by April, and then we'll be focusing on those waiting for a year. So we need to look at the most up-to-date figures. 7,000 extra beds will make a huge difference to the NHS.
OK, let's talk about strikes, shall we? Because the Prime Minister has invited union leaders to have what he calls grown-up, honest talks tomorrow. There are going to be these conversations with their representative departments. Is the Health Secretary prepared to budge when it comes to pay?
So the Health Secretary has invited the unions to meet with him this week as part of this initiative, and it is to talk about both pay and conditions. He's already met with the RCM.
We'll talk about pay, because that's a shift. It feels like before we were talking about conditions. Now the government is prepared to move on pay.
Well, we want to talk about pay, the settlement for this year, because the government is about to submit evidence to the independent pay review body for the pay award for this year. And I think it's really important to have those discussions with the unions about what's realistic, but also what they're looking for as well, so that we can send the most robust information and evidence to the independent pay review body. So
that
pay is on the table.
That's a clear change, isn't it? Because previously you were saying that it was conditions that were on the table, and now it's pay and conditions.
Well, I think the difference is we are now looking at this year's pay award, and we want to make fast progress on that, and we want to be able to submit evidence to the pay review bodies that the unions will also be submitting their evidence to, so that when the award is made, that there should be hopefully a consensus around what's awarded. So we're not looking at going back at post-dated pay awards. We're really focused on the pay awards for this year.
OK. And now, just finally, I want to talk to you with your Women and Inequalities hat on, because the Scottish Government has passed new legislation to introduce self-identification system for people who want to change gender. Do you welcome that, or do you have concerns?
Well, I know the Secretary of State, Kemi Badenoch, who's responsible overall for this area, has some concerns and has written to the Scottish Government. And I know that they are looking at that at the moment. We do have some concerns. Obviously, we want to make sure that for those people who want to transition, we're improving the process and speeding up what's quite a clunky process at the moment. But we want to protect women's rights as well, and we have some concerns. And that's why Kemi has written to the Scottish Government and is reviewing that at the moment.
I just want to know how far you're willing to go if you do have those concerns, because immediately after the vote, the Scottish Secretary, Alistair Jack, said the UK government had the concerns, as you in particular over what he describes as safety issues for women and children. And then he went on to say, we will look closely at that and also the ramifications of the 2010 Equality Act and other UK-wide legislation in the coming weeks, up to and including a Section 35 order stopping the bill going for royal assent. So are you genuinely considering blocking this bill in Westminster?
Well, that'll be a matter for Cabinet. And as you say, the Scottish Secretary and Kemi Badenoch, who's the Equalities Secretary, are looking at that and having discussions. The Conservatives were the only party that voted against that legislation. We do have concerns, but that will be a matter that will be discussed at Cabinet before the final decision is taken.
OK, but on the table then?
Well, both the Scottish Secretary and the Equality Secretary have indicated that.